Hi everyone, my name is Danielle and I'm a registered nurse. I actually went to school with Mrs. P, and that's how we became really good friends because we both decided that we wanted to help people in our lives. The only difference between her job and my job is my job, you have to see blood. So if you're afraid of blood, then this might not be the job for you. If you don't mind it, try it. On my name tag, I have RN, which stands for registered nurse, and it takes 4 years in college to get this career. I wake up at 5 a.m. I get to work at 6 a.m. I drink coffee with the other nurses and doctors, and then we meet our patients. We get the patients from the emergency room, from helicopters, and or ambulance. We deal with a lot of car accidents, people who have heart problems, people who have fallen and broken bones. We see a lot of different people. There's other job paths that you can take as being a nurse. You can care for moms and babies. You can care for children alone. You can also do surgery. Be right next to the surgeon as he cuts the patient open and operates. If you're into it, go for it. If it's too gruesome and bloody for you, then you might want to try something else. Anatomy was my favorite subject in school. I loved anatomy. And speaking of which, I have a really cool fact to show you guys. So in your spine, you have a top, middle, and bottom portion. So the top portion is your cervical, which helps your head turn back and forth. You have the lumbar, and then you have your thoracic. The thoracic is what I have to show you today. This is a real human being piece of bone. This is the thoracic. It fits right here in your lower spine. You can tell it's the thoracic because it actually looks like a moose. Here's the ears and here's the nose. A lot of people who come to me have smashed backbones from car accidents, or in between each of your backbone is a little piece of gel. So a lot of times people who have back pain, it's because the gels are smushed and the bones are rubbing together. So that's a really cool fun fact. Math is also required in this degree. You have to be able to calculate different dosage of medications. Science, the whole thing is science. Everything is science about this degree. So if you love science, try it. Reading and writing applies because you have to be able to read about different patients. Maybe they're allergic to bees. Maybe they had a broken bone before. You have to be able to read about your patient before you get to see your patient. If I could change anything in this career, it would be that I didn't have to wake up so early. 5 o'clock in the morning, it's still dark outside. But if I could change it to maybe like 8 o'clock in the morning, but I can't. So if you don't like waking up early, it might not be your choice. If you don't mind it, try it. I also wanted to tell you guys that speaking of the coronavirus, I wanted to show you guys how we get dressed to take care of corona patients. Yes, we get corona patients in the hospital. So really good hand hygiene is very important before you eat your food at lunchtime, before you go home and hug your families. It's very, very important that you wash your hands. So a lot of times in the hospital, every single day and with every single patient, I put on a pair of gloves. It's very, very important. I also wash my hands before I eat. And when I get home, I take a full shower. You also wear a mask. Wearing a mask is very important because if you sneeze or cough, little tiny particles go into the air. And if it goes on someone else or if someone else breathes it in, then they can get sick. So you want to wear a mask. It's just like this. We also wear gowns because like I said, if you cough or sneeze and it lands on someone else's uniform, you can get sick. We wear a hair bonnet so that coronavirus doesn't go in our hair. And we wear a face shield because we want to protect our eyes too. So guys, this is what it looks like when we get ready to go visit a coronavirus patient. This way we're completely protected from head to toe. If you guys have any questions, you can email me and I'll be happy to answer them for you. Once again, my name is Danielle and I'm a registered nurse. Take care, guys.